When it comes to heart health, one of the areas of the heart that doesn't get a lot of attention are the valves in your heart. Well, this morning, Dr. Shoba joins us to discuss heart valves and a new heart valve replacement options. Dr. Shoba, thanks for being here today.
Good morning, good to be here.
You know, I have so many people on my Facebook and social media that are going through heart catheterizations and different procedures on their heart, but hardly anybody mentions heart valves. But it's so very, very important, isn't it?
Yes, heart valves are very important structures in your heart.
Right.
It's like the door between two rooms. So the heart has got 4 chambers, and what connects these chambers or rooms are these heart valves. So if the door is partly stuck in the open position or it does not open, you can have a lot of issues. So it's the same thing with the valves. Either they get narrow, they don't open fully, or they open so much that they leak all the time. And this causes something called a murmur. So if your heart, if your doctor tells you, oh, I hear a murmur in your heart, it is nothing to panic about, but some types of murmurs can actually be fairly significant.
And sometimes I know that you can it can be something like caffeine intake or some medication that you're on that may be causing that. What are some of the other causes of the issues with your heart valves?
Actually, one of the common causes of leaky heart valves is high blood pressure. So if your blood pressure is high, the doors, sort of don't open and close properly. And the heart muscle gets thick, so that can cause a lot of issues. So controlling your blood pressure becomes very important. Most heart valve issues are very minor. Your doctor may order an ultrasound of your heart. It's the same procedure that they do on pregnant women, so it's very safe. You put that ultrasound like on the mom's belly, and you can see the little fetus or the baby inside. It's the same thing for the heart. They put a little ultrasound probe on your chest, and you can see actually the heart valves. The heart squishes and opens, and you can see the valves leaking and close. And so when you get an ultrasound report, it might say, oh, you've got a little leakage on your heart valves, or your heart valve is a little narrow. Nothing to panic about, because minor leakages are actually very common. Sometimes teenagers will have them, they will outgrow them, and sometimes when you're pregnant, you will actually hear a very loud murmur that goes away. We call them functional or flow murmurs. So some of the leakages and murmurs are very common. When you're very anemic, you may hear a loud murmur, the valve may leak, but then it'll get better over time. But some murmurs and leakage on the heart valves and narrow heart valves can actually be very significant. Some of the symptoms you need to watch for are mostly getting fatigued, tired, short of breath, your legs are getting swollen, so symptoms of congestive heart failure, and sometimes you will have rhythm problems or AFib or irregular heartbeats, palpitations. So these are some of the symptoms that you need to watch for, and it could actually be a heart valve problem. You may have no blocked arteries. Your arteries, your plumbing is completely normal. Your electricity in the heart is completely normal, but it's just these little creaky doors that are not right. And sometimes that can be missed unless you're specifically looking for it.
So if you present with any of those symptoms,
that's right,
you need to go to the doctor and get that checked immediately.
Absolutely, absolutely.
All right. Can't stress that enough. And also, really quickly, new heart valve options, replacement options. There are some out there. Tell us about them real quick.
Oh, yes. Previously, the only way to replace heart valve was to make this big incision in the center of your chest, ripping your chest open and cutting the heart, replacing the valve and sewing it back up. But now we can do it with that heart catheterization procedure. We make we go up with a tube from your right groin or your left groin into your heart, and then we actually put a little valve that is on a balloon, and we inflate the valve, and then we deflate the balloon and pull the balloon out so the valve stays in place. So you're actually squishing your own valve to the side, and your new valve is now replaced there. Now, and for some leaky heart valves, called for the mitral valve, you can actually go in like with a heart cath, and you can put a little clip. So if it's leaking too much, you can actually tighten it with a little clip with a heart cath. You're out the door the next day.
Wow. And you're saving all that invasive surgery.
Oh, yes, absolutely.
Because the downtime on that is amazing.
Oh, yes.
And so you're actually getting better results by doing less invasive surgery.
Oh, absolutely.
And that's amazing. How long has that been present? How long have we had that ability?
I think for about 5 years it's been fairly popular. It's gotten more coverage in the It's been going on for quite a long time, but in the last 5 years it's really picked up steam.
Because you hear these stories about I'm going in for open heart surgery and everything. This may cut down on some of that frequency of that.
Correct. The open heart surgery is mostly for your arteries in your heart or the plumbing, and that is a little different from the heart valve procedure. So they are a little different.
All right. Really quickly, things you can do to keep your heart valves healthy. I mean, smoking, of course, cutting out
Correct.
smoking, cutting down on caffeine, stress, things of that
Stress, absolutely. Anything that causes high blood pressure, you want to cut back on it.
Right.
And if you've got a family history of heart valve problems, people have been born with a bicuspid aortic valve, those can be genetic and hereditary. So if somebody's got a heart valve problem in your heart,
Right.
important for you to get checked out as well.
All right, Dr. Shoba, thank you so much.
Thank you so much.
Always great information, great advice. www.heart.org, and that number right there for more information on everything that we talked about here today.